Let's talk about the risk involved in the study before you decide to participate. The major risk is the possibility that the symptoms of your depression may worsen. If they do worsen to a degree that you or the clinical research staff thinks that it's not in your best interest to continue the study actually will be stopped. At that time, we're going to talk with you about how best to provide you with time-limited clinical treatment. There's also a possibility of experiencing side effects. Now, the most common side effects of compound X include dizziness, restlessness, tiredness, nausea, and headache, which are generally temporary and go away on their own. But should you experience any side effects that don't go away, just call us immediately at the number provided here on the consent form, and that's staffed 24 hours every day. Okay? Because you're going to have blood work done as a part of the study, you'll need to know the possible effects of blood draws. They may consist of bruising, numbness, or infection in the area where the blood was drawn. If you develop these symptoms, they will be treated if needed. Other possible side effects of blood draws are lightheadedness and dizziness.
I have become faint in the past when my blood was drawn.
Well, I'll note that, and we'll make sure that you're lying down when we draw your blood. You can withdraw from the study at any time and for any reason. Now, I may also end your participation in the study if I feel that the study has become too difficult for you, or if the symptoms have become too severe.
Okay.
Okay. There are no direct medical benefits to you from participating in this study, and we hope this research will help others with depression in the future.
If Compound X works for me, can I continue to use it after the study is over?
Compound X is an investigational drug. It's not approved by the FDA and is therefore not available in the community. We will provide you with standard medication for your depression for 10 weeks after the study is over. And if you wish, we can consult with your community physician to provide him or her with our recommendations for continued treatment.
That would be good. I know I do not want to go back on any of the other drugs I've tried.
Now, you will be informed of the results of your medical and lab test. And if any unanticipated risks become apparent during the course of the study that might affect your willingness to continue to participate, then we're going to discuss those with you.
What do you mean?
Well, for example, if the study medication causes you or any other participant to experience potentially dangerous changes in blood pressure, we do not expect this to happen. I just use it as an example there.
I see.
It's important that you understand that there are alternatives to participating in this particular research. Effective treatments for depression are available in the community, such as antidepressants and talk therapy.
I understand. I've tried some of those treatments already, and none of them have worked for me.
Well, while you're participating in research here, however, you will have a medical record and a research record. Both will be kept confidential. We cannot release medical records without your permission. However, because we are a federal facility, there are several agencies, such as Congress and the FDA, that may have access to your medical records under certain unusual circumstances, such as a review of the protocol itself that we use. And we would also have to break confidentiality in order to provide clinical treatment if you were to become suicidal or dangerous to others. We will provide short-term treatment for any injury you incur while participating in the study. Now, we do not provide long-term treatment for research-related injuries. Now, you have the right to seek legal action should you feel a long-term injury has resulted from your participation in research.
I see.
Now, you should also know that there is no compensation or payment for your participation. You understand that? Okay. Here's my telephone number. It's 301-999-8888. If you need to reach me urgently, you may contact the NIH page operator at 301-496-1212. NIH also provides you access to a patient care representative. This is an individual who is employed by the clinical center to address any concerns or complaints that subjects or their family members may have during your study participation. Her telephone number is here on the consent form. This is the line for your signature. Now, we would like for you to sign and date it, but before you sign and date it, do you have any questions?
I don't think so. You've touched on all my concerns.
Okay, great. Just sign that and date it if you may. There. Now, this is a signed copy of the consent for you to keep. Thank you for coming by and participating in the study with us also.
Just seen the essential elements contained in an effective informed consent procedure. To sum up, there should be an introductory conversation between the researcher and subject that includes a discussion of the voluntary nature of research participation, study purpose, qualifications to participate, design and duration, risks, discomforts, right of withdrawal, benefits, new findings, alternative treatments, confidentiality, the policy regarding research-related injuries, compensation, and contact information to address any problems or questions the subject might have regarding the study.